Hi, I am Dr. Moupia, eye plastic surgeon and oculoplastic surgeon practicing at Bangalore. I have been in this field since the last 20 years. Today I will be discussing with you a condition which is called lag of ophthalmos, in which the eyelid does not close fully even when the person is sleeping. This occurs due to weakness of facial nerve and is commonly seen due to viral infection which is called Bell's palsy, inflammation, injury, stroke or due to tumor, and can also happen after tumor removal. There occurs continuous watering and redness of the eye, and the patient also becomes prone to infection. Temporary measures to protect the eye when the eyelid is not closing are using lubricating drops and gel, taping the eyelid at night, and botulinum toxin injection to enable closure of the eyelid, which is also called chemical tarsorrhaphy. When the inability to close the eyelid is thought to be permanent, or when the eyelid has not recovered for more than 6 months, then various eyelid surgeries can be done to correct this. One of them is a simple technique of eyelid loading with gold or platinum implant. The weight of the implant enables closure of the eyelid due to gravity. I use trial gold pieces of various weights to find the most appropriate weight which will close the eye fully. The implant is placed on the eyelid and the patient is asked to normally open and close the eyelid. The weight which enables complete closure of the eyelid without making the eyelid droop is chosen. The surgery is a simple one. It is done under local anesthesia. Incision is made along the lid crease or eyelid fold. Dissection is done through the muscle of the eyelid, and the cartilage of the eyelid, which is called the tarsal plate, is exposed. The gold implant is sutured to the tarsal plate with non-absorbable sutures, and the orbicularis muscle and overlying skin is closed. Here you see a few before and after pictures of my patients. Mrs. Ambika is a nurse in Bangalore, and let's hear what she has to say.
My name is Ambika NC. I am in staff nurse. I went for surgery for brain tumor. 12 years I am suffering like anything. I came here for Moupia madam as I consult with simply I came one day. Then she suggests me from some gold weight surgery. About that I am feeling okay, I'll go for that. Then I am going now. Before this surgery I am suffering like anything. Daily I am suffering, and daily I am putting the drops 2 hours once, like lubricated. Then after that night time I am putting some plaster. When I am driving the vehicle, without glass, without plaster, without this one eye drops, I can't stay at all. Now happily without after surgery gold weight I am so happy. Now I am staying without anything, any medicines, without glass also. No lubricated, nothing plaster, nothing else. Now I am my eye also like clear white. Before that full of redness. Daily I am feeling. Now so happy.
Drop in any questions and comments and I shall be happy to answer. Thank you and have a nice day.